Guys, I just want to give you a little update. I just got back from my doctor's appointment in Ann Arbor, and everything's looking good as it can be. Yesterday I finished my last radiation. I had 15 treatments to my neck, to the tumor in my neck. We kind of moved fast on this process because when I got my scans back, they noticed that the tumor was pushing on my spinal cord, and it has eaten through 2 of my vertebrae a little bit. So they were really nervous that I was going to wind up being paralyzed from the neck down if they didn't start treating it right away. They were really nervous for me to go to California on my vacation because they didn't want something to happen while I was gone. So they sent me with some medication to take if my arm went numb, and then call the doctor right away to kind of stop the process. But I came back with no issues at all. Like I said, I had 15 treatments, and it's about a 5-minute process Monday through Friday. And as you can see, it's burnt my neck really good. I also have a burn in the back of my head, and it came up into my hairline, so I'm missing hair from there, but the hair should grow back. And this time it really took a lot out of me, I think because of the area it was in. I was feeling really lightheaded, and I was also taking chemotherapy at the same time, which I've never done both at the same time. About a week ago, I kind of had an incident because I haven't been able to eat or drink very much, so my chemotherapy drug had been building up in my body, and I kind of almost overdosed on my chemotherapy medication. So I had to let that detox out of my system. So I haven't been on chemo for a week now, and I can't really eat or drink anything. So I've been taking Ensure, the boost drinks, to make sure that I get my nutrients, because from last Friday to today I've lost 10 pounds, which is not good. So they're really monitoring my weight and stuff right now, just to make sure that I don't lose any of my nutrients and I can stay as healthy as possible, because I will now be going on to the drug trial that I've been accepted into. First I had to get the radiation done because it was an active tumor. So that was one of the processes to get into this drug trial. So this new drug trial is a protein inhibitor, which is not a chemotherapy, so I won't feel fatigued, nauseous, lightheaded. Any of those symptoms should not be there. This is to block the cells from growing and spreading. It can also help the decrease in the tumors that have been treated. So I'm really looking forward to this. It's going to be a process to get it started. Before I can start, I have to have a biopsy of some of the nodules in my right lung, and have some scans, some respiratory tests done to make sure that all my functions are good, and I can get a baseline on everything and get the size of the tumors. That way they can monitor and see if they're growing or shrinking. After that process is started, I have to wait for a month from yesterday to start, actually, because you have to have a month in between your last treatment date and the beginning of this drug trial. So that will give me time to get my scans and the biopsies done. Then I will go to Ann Arbor every 3 weeks for an infusion. So I'll go and I'll get my blood tests done, and then I'll go see the doctor for a checkup, and then I'll go to the cancer center and get an infusion. It should be about 30 minutes long, and it will go right through my port, no veins needed, and I will do that every 3 weeks. And every 6 weeks I'll have a scan to see and monitor the size of the tumors, and then after 8 weeks of being on the trial, I'll have a second biopsy done. So this drug trial is different from the other drug trials I've been on, because the other drug trials were blind studies, which meant that I didn't know if I had the actual drug or the placebo. This one, everyone receives the actual drug, and they know how much they're getting, and that way I know for sure that I'm getting this drug. The doctor said that he's seen positive outcomes from some of his patients that have the same kind of, almost the same kind of cancer as me, and he's really positive about that, so that makes it positive for me. But I'm just really excited to get this process started. It will be more time in Ann Arbor, but I won't have to worry about taking my medication every day and worrying about the side effects and that the chemo has been causing my body, and hopefully my body can finally fully heal and I can start regaining some of my nerves back in my leg even faster, because those chemo drugs aren't so toxic and causing them from healing. But I just wanted to say thank you so much for all the continued support and love. You guys are amazing, and I just wanted to keep you guys updated and let you know how I'm doing. Alright, thank you.